Mr. Yip Hon Wing.
Sir, there are ongoing efforts to improve information sharing and the delivery of digital services to enhance the patient experience. The National Electronic Health Record, NEHR, system enables the sharing of patient summary health records across care providers, including the 3 public healthcare clusters. We will progressively build up its coverage to include information from more healthcare providers to support care continuity. A common pharmacy system for the 3 public healthcare clusters is underway to allow the consolidation of patient information, which allows providers to have a more holistic view of patients' medications and facilitate the filling of prescriptions. MOH and the healthcare clusters are also developing a national charging and billing system to streamline processes and enable a more consistent experience for patients. Common digital services across the clusters, such as the scheduling of appointments and bill payments, are available on the National Health Hub mobile app and web portal. Health Hub also displays personal health records drawn from national systems, including, for example, the COVID-19 vaccination records and COVID-19 test results. These common services are also made available through the cluster's apps. This reduces the duplication of the development effort and facilitates a consistent user experience regardless of the platform a person uses to connect with our healthcare system. Meanwhile, the presence of healthcare cluster-specific applications enables those healthcare providers to customize features tailored to their specific facilities and services, and also to innovate on user interaction features that could better engage their patients. Over time, some of these new innovations that are well received and are successful in engaging patients can be incorporated as common services that are then made available to all patients in their preferred platform, be it Health Hub or one of the other cluster apps. We will continue to improve our digital services and enhance our offerings to improve the user experience. Thank you, sir.
Mr. Yip Hon Wing.
Thank you, Mr. Speaker. I thank the SMS for his reply. Will the Ministry consider integrating all healthcare functionalities into the Life SG app, since more than 70 government services are on the app already? This is to make it more convenient for residents, as they have only to use one app to interface with government, as opposed to downloading many different apps to interface with the government. Thank you.
So we continue to study all the different modes and for patients and citizens to interact with government. Life SG is one of those. It aggregates a number of services. There are other portals and means through which citizens engage with government. And the engagement with government is different from the engagement with your healthcare provider. So where it works for the patient experience, maybe for safety, for information gathering, for user experience, we'll always be considering how to optimize and streamline. And the nature of many of the products and platforms that the member refers to is that they are the front end for common core services. So that the backbone is common, the data standards are common, the information sharing processes are common, but then engaging with a particular provider allows a user experience as well as facility-specific services to then be deployed. So it's not an either-or. And the example that he gave with Life SG is salient to this, because in Life SG, many of those functions are also accessible through other means, where it is appropriate for either the provider or for the citizen. So we'll continue to review the entire space. Thank you, sir.